Hey guys, good evening. How are you? I hope we're all staying safe. So today we're going to be talking about all things cervical cancer. I'm Dr. Marietta Imadejemu. You might know me on social media as Eta MD. So we are going to get right into it once I start seeing your wonderful comments and maybe faces with your emojis. Okay, so this January is Cervical Cancer Awareness Month. I know that we have been seeing a lot of um, awareness flyers and graphics and a lot of things. A lot of people have also been giving us tips on what to do and what not to do. So if you are here watching and you haven't, been screened, or you have not gotten a vaccine, any HPV vaccine before, then you really need to tell us, like, what's up, what's going on, ladies. So this session is not just for ladies, guys. You're welcome to join us. And I also want to thank CHSS for inviting me. I'm happy to be here. Cervical cancer is something that really takes a lot of lives, and I get so sad that for something very preventable to a very great extent, it should not be killing Nigerian women at all. It shouldn't. So it's something we should talk about. It's something that we need to keep talking about, and yeah. So we're going to keep doing that. So hi, Toby. It's nice to have you here. Okay. So, how are you, Toby? What's up? So, have you been screened? Have you ever had a cervical cancer screening before? So, girls, just let me know as you join in, okay? Alright, we'll get right to it very soon. Do you know anyone who has screened and who also told you about their experience? Is this something that may have discouraged you from having your own experience? Okay, it's a wonderful evening. I'm sure some of us are just, getting back from work and trying to settle down. I know that that's what a lot of us are doing. So I understand. So, hi, Toby. Yeah, we're going to get right to it now. And yes. So, I know we have a lot of questions when it comes to cervical cancer, but we'll just try to go through the major aspects that I think every woman has to know. There are so many things that we should know about cervical cancer. So I would try to use as much basic language as possible just so we can all follow. If there's anything that we need to clarify, please quickly let me know. So first, we really want to know, what is cervical cancer? We keep hearing about this thing. So first, before we know what cervical cancer is, we need to know where the cervix is, because knowing where the cervix is and knowing that, okay, this is cancer of that part of the body, then it's very easy from there. So the cervix is a part of the uterus. The uterus is also known as the womb. The cervix is popularly called by a lot of us the neck of the womb. It is like a passage zone between the uterus and the vagina. So if there is a baby in here, we can understand that from pregnancy. Well, if there's a baby in here in the uterus, now there is a part that is usually, more, would I say, a bit more closed, and that part needs to expand usually for the baby to come out. When they keep saying push and push, that's what they're trying to say. They're just trying to tell that baby, they're just trying to tell that mother to do what she can to help that aspect of her uterus to expand. So that's the part that we call the cervix. It's like Lagos and Ogun State, you know. Lagos is the big city, but then Ogun State is kind of like, there's some parts of Ogun State that are kind of like inside Lagos, but then you have to pass that aspect to maybe get to, let's say, or I don't know, but you get the gist. So that part of the uterus is the cervix, and the cervix can have a tumor, so an abnormal cell change that becomes, very troublesome. And it is when it is malignant, when there is something that is cancerous in that aspect, that's when we say that there is cervical cancer. Now, why does this happen in the first place? What even causes cervical cancer? Now, there are many things that we would say are risk factors for cervical cancer, but the major cause, the one thing that we have identified to have caused, a huge number of cases of cervical cancer is human papillomavirus. So the human papillomavirus is a sexually transmitted infection. Now, a lot of us must have had HPV at some point in our lives, but then there's the high risk one, which is the one that really causes the cancer, and there are the low risk strains. So for the high risk strain, they are the ones that when the person gets them, it is more likely that that can transform into cancer. But the truth is, a lot of people will get these strains and not ever come down with cancer, because your body has a way of, fighting and, trying to remove whatever it is that is causing some abnormal changes in your cervix. Your body has a way of doing that, and it does that within a few years. The estimate is like over 2 years. But then there are times that this doesn't happen. The transformation just continues, just goes on and on and on, and it can get to the stage of actual cancer. And it's at that point that the matter gets really bad. And the problem with cervical cancer really is the fact that when it's happening at those early stages, people usually don't know. They don't feel anything. But when it has become, more advanced and in the late stages, that's when you start seeing some kinds of things. So these are now the symptoms that the woman will start feeling. So things like pelvic pain, you will start having pain in their pelvis. So your pelvis is like that aspect that you want to use to do your infinity dance and your infinity walk. Okay. and and this is really scary. It's really scary. Forget the fact that I'm trying to, just make us follow, but it's really scary because for something that only bugs you when it is really late, then that's a terrible thing, because it's going to not only reduce the chances of one getting treated, it's going to reduce the prognosis as well. So it might be harder to get the person from where the person is to wellness stage. Do you understand? Hi Obeyoye, hi Fisayo, hi guys. So just tell me, you guys should tell me, so who has gotten screened here and vaccinated, or who made a few people get screened and vaccinated? Just let me know. You can share your experiences in the comments while I talk. So I was talking about the symptoms, and the first one I mentioned is the woman can start having pelvic pain. So she can start feeling pain, and sometimes they're not even able to explain it. Just feel a lot of discomfort around, like there's some kind of pressure somewhere around their bladder, somewhere around their rectum, like their anal region. People just start feeling, they complain all these things to you. But then one of the very major symptoms is that the woman can start bleeding after sex. So after having sex with her husband, the woman can spot, just notices some kind of blood. That's because on contact with a cervix that is already injured and is undergoing cancerous changes, it bleeds easily. That is why the woman will have such. And some women may also have irregular bleeds, that is in between their periods, they start having some kind of bleeding. So these are some of the symptoms that a lot of women would face. Now, I know what's on your mind, like all these things you've talked about. Am I at risk? What exactly would make me get this kind of thing? Yes, God forbid. I'm a Christian. I really pray to God that He should deliver us from all this. But we need to also do, what we can and know what we need to know, right? Okay. Now, why would you be at risk of cervical cancer? Why would cervical cancer just look for this pretty woman and just say, this is the person I'm going to face? It's it's annoying. It's really annoying. But the truth is that there are some things that make people more vulnerable to this condition. Now, as we've already mentioned, one of the most common causes is what? HPV. So, for a woman that has been infected by HPV, well, it's more likely that she's going to come down with cervical cancer. At least she has a higher risk than somebody who is not. And then I mentioned that HPV is actually a sexually transmitted infection. Now, it means that for women who have multiple sexual partners, for women who do not practice safe sex, well, it's highly likely that you are at more risk than someone else who is not having, who doesn't have these habits. So it's good that you know that some of the things that we think are the usual things we do in our normal life, well, I met this guy and then I met the other one. Oh yeah, I had five in a night. Oh dear, yes, you have so much story to tell. But please practice safe sex, because we're not just talking about HIV now, we're also talking about HPV, and this can eventually be a burden later in future if it actually causes cervical cancer. Now, another thing we need to note, aside HPV, there are many other factors that come into play. Remember, I mentioned that when HPV actually infects, sometimes what we do, what our body does, is that it tries to clear it off, right, to our immune system. Now, so for people who already have some form of immunodeficiencies, people who have some immunosuppression of some kind, so people who already have HIV virus, people who already have some other types of conditions that reduce their immunity levels, then it is more likely that for such people, HPV is going to thrive in them. Now, if you smoke, oh dear, please, you should stop. There's really no reason why you should smoke, because smoking has been linked to so many diseases. Like, when exactly are you going to realize that there's nothing good about smoking? I know it's not an easy thing. We talk about it. Stop, oh stop, oh stop. I know it's not like you want to really continue and all, but if you need to get help, then feel free. You should. You can. There are psychologists in Lagos that actually offer such help. Maybe I should even get like look for some of these resources and share with some of our youth, because a lot of people actually talk about this. So smoking is something that increases your risk of cervical cancer, and this is something that there is really no excuse for doing. You don't even need to do it. Like, just pretty much just stop, guys. That's all I really have to say about that. Now, also for females who have exposure to sex when they are really young, they are at a higher risk of cervical cancer. Guess why? Hi guys. Hi Alabi Damola. How are you? So I can see you guys. Okay. So yeah, I was saying that for a woman who has early exposure, so women who usually have exposures when they are, below teenage age, so maybe like 10, 11, actually less than 16, so they have a higher risk of getting cervical cancer later in life. That's because if at that point they get infected with HPV by any chance because of their sexual activities, now the walls of the cervix and the vagina at that point is less likely to be able to fight off, such infections, as opposed to when they are more mature. That's because at such a young age, you find out that wall is thin. Usually the amount of estrogen in the lady is not, as much as, should be when they have, attained puberty and all. And so it has a higher chance of being transformed, to cells that are how would I explain to you now? That dysfunctional, yes. So it is more likely for such cells to be, to go terrible. I don't want to use words that I should not be using. Okay, so this is why we also emphasize for women to also pay attention to their daughters and explain to daughters that this is really what you should know. Give them right sex education, and it will help them to grow into being better and making better choices. Now, I know that aside from risk factors, you would also want to know a lot about, okay, how do I prevent this? Now, for the prevention, we always talk about it because for something that does not come or give you any signs when it's early until when it's really bad, then you know that for such, prevention is better than cure. Prevention is better than cure anyway. So it's good that we take precaution. It's good that we do what we need to do to be able to prevent this deadly disease that is killing a lot of women. It's one of the leading causes of death in women in Nigeria. Now, it used to be like that for the whole world, but now in America, things are reducing because they are really paying a lot of attention to screening, well, until COVID-19 came along. So, we need to understand that for prevention, there are two major things that we can do. Aside making sure that we, do all those things I've already mentioned, practice safe sex, be faithful to one partner, no need for multiples, really. And then making sure that you do not smoke. Well, there are two other things that every woman has to do. That is one, early screening and maybe treatment if anything is found for cervical cancer, and vaccination against HPV, which is the leading cause of cervical cancer. So that is why I keep asking, like, if you've not screened, if you've not been vaccinated, what's up? What's happening? Really? Because people have been talking about this thing day in, day out. Like, we really need to pay attention to the things that we should be doing, guys. So for screening, what does it entail? Now, screening will usually entail a pap smear test. Every woman, once they've become sexually active, should get a pap smear test. So when I say sexually active, if you've ever met man, that's what I mean. Like, if you've ever had sex, that's what I mean by sexually active. And sometimes people think that the sex has to be, the penetrative sex. Yeah, that's what we're talking about. And yes, penetrative sex, that's what we're supposed to mean. But then there are all different types of things people do these days. Anal sex, you just rubbing skin to skin, and all those are like avenues for you to spread HPV. So please get a pap smear test done. Now, the reason why we will always prefer that women who get this test done should not be virgins is because the test usually entails trying to open up the cervix, opening up, like you have to, like, sorry, the vagina, I mean. So the vagina goes like this. It's like a pathway, and then you get to the cervix, which I said is like the neck of the womb. So it is that zone that you pass from the uterus down coming to the vagina. So when we want to do a pap smear test, our goal is to take some cells from the surface of the cervix. That's what our goal is. But for us to get there, we need to go through the vagina. So for someone who has never had sex before, it's like you forcefully opening up the vagina when it's like trying to tell you that, auntie, I've not been opened yet. Do you get what I'm trying to say? So that's why we always prefer that these women are sexually active. But also, more importantly, it is best that women who are sexually active actually have this test, because they are the ones who are at risk of actually getting the HPV. Do you guys get what I'm trying to say? Okay, so when we take a sample from the cervix, what they are looking out for is any abnormal cells. So this helps to tell us, is this person in a precancerous stage? Now, from the time a person is infected with the human papilloma virus, till the time when the person actually gets some form of, you know, when the cancer changes starts, it is a long time. So sometimes it takes years, a decade or more. But then at those transformative years, during those transformative years or that period, the problem is the person usually doesn't know that that's happening. So the screening test is to help to find out what is going on early in life, because that's the time or the best time to actually treat whatever it is that is going on. Now, when that happens, if the pap smear test comes out negative, awesome. So the woman within between the ages of 21 years, which is the usual age for which you should actually have a pap smear aside being sexually active, till about 30, you can do it every 3 years as long as it's negative. In fact, your doctor will actually tell you the best time for you to come. Now, if it's positive, then we have to go on to another test, which we call the colposcopy. So the colposcopy is a test that helps examine your cervix more closely. Sometimes we even take a biopsy so that we can know better if it's something that we need to, start treatment on immediately, and also to be able to plan what kind of treatment is actually best for the woman. So those are the stages it will go through if it is positive. So for a woman who is negative, then your doctor will tell you when next to come. But then if you are between the ages of you started you started doing your screening at 21, right? If you are 21, 22, up to 26, and you have a negative pap smear test, you can get a vaccine. You can actually get vaccinated. So the vaccine is the HPV vaccine that protects against HPV. Yeah. So I will not say cervical cancer because um it is particularly made to help protect against HPV. But then, since HPV is a major cause, then it helps to prevent like over 90% of cervical cancer cases. Now, what does the HPV vaccine entail? The HPV vaccine has different types. So the two major types are the Cervarix vaccine and the Gardasil vaccine. Now, all these are not as important to you as you just going to get your vaccine, but then you may be asked because sometimes there are two vaccines available and people want to know like what exactly are you interested in. Now, the Cervarix vaccine covers for the two major strains of HPV that cause cancer specifically. Meanwhile, the Gardasil vaccine, on the other hand, covers for more strains of HPV. So HPV also causes other things. Cervical cancer is just the thing that we all keep talking about. Yes, I know we've talked about it so much, but that's because we really care about our ladies. We don't want African women to keep dying, really. They are too awesome to, just be lost to such a disease. So HPV can cause many other things, including genital warts, some anal cancers. It can cause some other things, and there are other strains that can predispose to all these other types of conditions that are less common though. Hence, there's a Gardasil vaccine that would protect against more of those strains. Okay. Now, now that you know that you should get screened and that you can get vaccinated, you need to know that the thing is normally, in fact, now the federal government is introducing the HPV vaccine like under the national program for immunization, so that we would actually vaccinate our young girls and boys, because boys too can receive this vaccine. So girls usually receive it between the ages of 9 to 26, and then boys can receive it between the ages of 9 also to about 21. So if a lot of our young boys and girls are vaccinated against HPV, then it means that we can actually end cervical cancer soon. Like in a few generations, we'll just wipe it out like polio. And the thing is, sometimes we just don't think about these things because they don't look urgent. They don't nobody's worrying us, we're not dying, and so why should we bother? But then I just realized that a lot of things that are happening to us now are, as a result of decisions we have made in the past. The reason you are where you are now is because you decided to get a skill, maybe get educated, um you know help yourself learn something better, try to be the best, and now you are where you are and you know the things that you know. So it's the same thing for health. Just look at it like an investment. It's not going to, it's not like you have cervical cancer now and you have to treat it. But then why wait to get something that is already known to be, you know, difficult to overcome when the condition is already there? Do you understand? So just realize that it is an investment you're making. Now, the cost of getting a screening test is usually is not so much actually. In a lot of hospitals in Lagos, it is between three to about maybe 6,000. Yes, I know that saying whether it's so much or not so much is relative, but a lot of us take Uber to the island. A lot of us take Uber to and fro work. A lot of us, buy shawarma. Yes, aunties. And some of us have, Valentine's coming up, and we have big plans. Some people are even saving already on piggy vests that we want to show them that it is us. We are the couple of the year. Please, hello, uncles. One thing you can actually do for your partner is to actually book them a test, like get them tested, encourage them to get vaccinated, and you would have done something so good for them. Like they would forever remember you. Honestly, me, I remember Sha, if I'm the kind of person that like do that for. I'm sure a lot of ladies here will be happy. Okay, so also to get a vaccine usually will vary between maybe 10 to 13,000 depending on the hospital or the center. I know that a lot of organizations have resources on the different places that you can even get these services done. We have Smile with Me, we have Optimal Cancer Care. There are a lot. There are actually a lot. So you can always check them out. Even CHSS is getting a lot of resources on their page too. So there's a lot really out there for us to help us to really overcome this virus. So let's not delay. Let's try our best to take up whatever we have been given and make the best out of it. Yes, guys. So I would accommodate questions now. If you have any questions, guys, please feel free to send them. Feel free to send us any questions that you have. So while I'm waiting for questions, it's good we also know that yes, during the COVID-19 pandemic, which we're in, it's a bit more difficult now to like really get screening tests in some centers because of the change in the way centers work now and all, and because of also the change in the way healthcare is being given now. A lot of people are doing home consultations and whatnot, and that's why we now some other kinds of programs are being developed like self-care testing for HPV. So imagine if you can actually just be at home and test yourself if you have HPV or not, so you will know if you should go to your gynecologist and report, or your doctor and anybody that handles this for you in your hospital. And yeah, that might actually be the future. Yeah, it's just that a lot of the time women may not really be able to take the sample as much as correctly as they should, but then there's something to look forward to. The fact that you can just be in your house, I'm sure a lot of women would like to do that. Like nobody likes to go to the hospital and be told, yes, we want to do this for you now, and for us to do that you need to pull off your clothes, like really, doctor, like down to the last. Like, do you actually mean? So like a lot of people ask those questions, and it can be really frustrating because you just stand there and be like, Auntie, please, can you do what you need to do so that I can go to the next patient? Not that you don't understand them, but you're just really busy, and you really wish that they would understand too that you really don't have anything to like gain from them just pulling their clothes and you doing whatever you want to do and get it over with. Yeah. So if you have questions, please feel free to ask them now before we go. So you can ask your questions. Yeah, so somebody has asked me before, like, is there any hope now for people who already have cervical cancer? So maybe you know a relative who is currently fighting the disease. One thing you should know is, yes, we keep saying how you can prevent cervical cancer and the things that we need to do to ensure that we do not um, um, become, we do not like come down with these conditions. But we need to understand that even when someone comes down with this condition, it's not because they haven't, also done their best. So it's not something that you now start. It's not a blame game, and you now start asking now, what did she do wrong, or what did he do wrong? You know, yeah. In this case, only she. So that's not the case. Also know that yes, the prognosis may not be as good, but then there are people who have been able to fight it. So there are different ways that cervical cancer is being treated. So we have the surgery, and then we have chemotherapy, there's radiation therapy, and then there is also some kind of targeted therapy that is now being introduced like recently. So in surgery, what happens is that surgery tries to remove, the tumor where it is on the cervix, and in a bid to prevent it from spreading. So usually for for cancers that are, still early, it's a cancer but it's early because it has not spread, surgery can do that. Now there are some where some of these treatments are like in a combined, I don't know, they're combined to um help with the treatment of the person, so you can do surgery and also the chemo. So there are ways that these treatments are combined by gynecologists that are focused on oncology, and they can get some of the best outcomes. So there's also targeted therapy where there are certain medications or certain medications that are actually used specifically to stop the growth of the cancer cell. Yes, and in some cases they have proved to be successful. Yes. So if you have a relative or you know someone who has cervical cancer, the best thing is to support them. Don't be in their faces all the time, asking them, numerous questions. They are human beings, also living their life as much as they can. So there's no need bugging them too much. Just support them where they need to be supported. So you can, help them do stuff, but not treat them like they don't have hands and things like that. No. So yes, that is a lot, like a summary of a lot of what you need to know about cervical cancer. Yeah. All right. So if there are questions that we have that we may not have asked, or if there are other things you'd want us to talk about, then some other time we may make time to be able to do that. Okay, guys. So you can maybe send your questions later if I guess some of us are a little too busy. Maybe we could watch it later. Okay. So guys, I'm Mireta Madajimo, and we have talked about a lot. So I'm just going to recap now to tell us, the salient points that we should take home. First is what is cervical cancer, and we have mentioned that it's a malignant tumor of the cervix. Cervix is a part of the womb, and it's the neck of the womb. So what exactly causes cervical cancer? We said that one of the major causes is HPV, and HPV is transmitted through sex. So that's why we should have safe sex and be faithful to our partners. So the same thing that goes on for our ABCs abstain, be faithful, condoms, all those things also follow here, to be able to prevent HPV, which is the major cause of cervical cancer. But we have also mentioned that there are high risk strains of HPV and there are low risk strains. So the high risk strains are the ones that would usually, after a few years of transformation of the cells in the cervix, can now become cancer. But before then, we mentioned that what you should take as much of that time to do lots of screening every 3 years, and your doctor will tell you when to come back, and you can continue screening up to like an older age, usually about 45 to 50. You'll be told when exactly you should stop. You can actually get, once you have been screened and you have been told that it is negative, your doctor will tell you the next time to come after a negative pap smear test. But if it's positive, then you might now go on to colposcopy, which would involve a closer look at the cervix, and then a biopsy might be needed. That will involve taking a small sample that is like part of the tissue of the cervix. And then we also mentioned that if you are for women between the ages of 9 to 26, yes, they can get vaccinated. But then WHO has even said that women up to 45 years old may even get the vaccine. But the news is that may also be reviewed. But for women who have been getting it who are above 26, we've not had any reports of any terrible thing happening. It's just that it's more effective, way more effective when it's done below the age of 26. That's till the age of 26. And then we also mentioned that yes, if you're at risk, you can be at risk if you're doing any of these things that I mentioned. And I have also mentioned how we can prevent it. And those ways are screening and vaccination. They are top tier things. But then if we now want to go down and say, okay, what are the other things? So we talked about not smoking. We've talked about our ABCs, abstain from sex, even though that you just leave it. Or if you really need to have sex, then be faithful to one partner. Or practice safe sex using a condom. Now you can't, HPV is not like pregnancy now that you're saying, oh, I take pills, or I have the coil, I have this. No, it's actually an STI that can travel if you don't use a barrier method, so you have to use a condom. And then we also mentioned that for people who already have cervical cancer, that there are also ways in which we can treat. Okay. All right, and in this COVID-19 pandemic, even if it's seeming like there are delays in getting, treatment, and it's seeming like there are delays in getting screening tests, we explained that the future is self-testing, right? So like you can actually be in your house and you get tested, which is awesome. All right, and then we also mentioned that even if it's COVID-19, or even if we're in a pandemic, guys, just know that you can still get tested. You can actually call the centers where you can test and ask them when you should come, and then make an appointment and actually go. And now the government is even adding HPV vaccination to the MPI. We're not sure yet what age will be covered, up to what age will be covered for insurance companies and also for the NHIS. But we know that is a very welcome development, and it's awesome because it's really going to reduce the cases of HPV in Nigeria. A lot of us are very happy, and of course in that way it's now going to reduce the incidence of cervical cancer. So guys, it was nice talking with you. If you have any questions whatsoever, and then if you see any symptoms in anyone that's close to you, as we've mentioned, pelvic pain, irregular bleeding when they are not supposed to be menstruating, or bleeding after sex, please, the person should report to the doctor immediately. This is not the time for roaming around trying to look for drugs to take to stop something happening. Like, why do Nigerians do that? Doctor, what drug should I take? Like, what's that exactly? Why do we always ask that question? Like, drugs don't solve everything. And why do we always think that when we just say one sentence, then the doctor should know what drug there is to take? No, that's not how it works, guys.
Please don't play with your lives. And people who do that with you and tell you take this once you say this, please beware of them. A lot of doctors don't actually do that, so just check very well. I don't know if their license is correct. Okay, that's just a joke. Well, still, the serious part is that it's not everything you just ask for a drug for and then you know scat off or something. You really have to sometimes understand what is going on and why. Okay. All right, so it's nice having this chat with you all. Thank you, CHSS, once again for making this available for women. And yeah, maybe sometime we would see each other again, guys. Bye, Nika, Tamler, everyone. Bye. Bye.